utilized defense mechanisms to prevent unacceptable thoughts and feelings from emerging into conscious awareness. So, so the unconscious memory system for the uh, causes the anxiety responses. So the goal for treatment or therapy would be, it's not to eliminate all the anxiety, but to help the individual increase the tolerance of anxiety, uh, and and to and to and to use it as a signal to investigate the underlying conflict that it has created. So it it has been said that uh, some anxiety is related to multiple conflicts at various developmental levels. So disintegration anxiety, there is a fear that the self will fragment because others are not responding with the needed affirmation and validation. Persecutory anxiety, so self is being invaded and annihilated by an outside malevolent force. Castration anxiety, so the powerful parental figure may damage the little boy's genitals or otherwise cause bodily harm. And superego anxiety, wherein there is a related guilt feelings about not living up to the internalized standards of moral behavior derived from the parents. So, behavioral theories, it has been said that that in classical conditional model, so example would be a girl raised by an abusive father may become anxious as soon as she sees the abusive father, and later on may distrust all men. Sorry po, wait lang. So in social learning model, the child may learn anxiety by imitating the anxiety in the environment. For example, if he or she will see her parents. So for the existential theories, so these are theories that provide these are theories of anxiety that provide models for generalized anxiety, in which there is no specific identifiable stimulus exists. So it has been said that the persons experience feelings of living in a purposeless universe, and anxiety is the response to a perceived void in existence and meaning. So this is the following figures I will show you is from Stahl. So it divides anxiety into two symptoms and brain circuits. So fear and worry. So fear would be due to the amygdala-centered circuit. So worry, on the other hand, such as apprehensions, obsessions, anxious misery, is from the corticostriato-thalamocortical circuit. So it has been said that the affect of fear are regulated by the connections between the, can you see this, everyone? Can you see this, guys? So this is the connection from the amygdala and the anterior cingulate cortex and the orbitofrontal cortex. So overactivation of these circuits may produce the feelings of fear. While in avoidance, so feelings of fear may be expressed through behaviors as avoidance, so which is regulated by the connections between the amygdala and the periaqueductal gray. So it has been said that it is a motor response leading to the fight or flight or freeze. So in response to a certain threat. So here, in breathing or in the respiratory system, so Changes in respiration may occur during a fear response because of activation of the parabrachial nucleus via the amygdala. So, inappropriate or activation of this parabrachial nucleus can lead not only to increase in respiratory rate but also symptoms such as shortness of breath, exacerbation of asthma, or feelings of being parang choke. So that's why, I mean, some patients would say na parang dili ko kaginahwado, parang uotang dughan. This is because of the activation of the parabrachial nucleus. And then the endocrine output of fear. So it is characterized by an increase in cortisol. So which is because of the activation of the HP axis. So in acute anxiety, this causes parang adaptive, pero if it is chronic, it causes uh, risks for coronary artery disease, diabetes type 2, and stroke, and other cardiovascular na mga diseases. And then for the cardiovascular system would be the autonomic responses are typically associated with fear. So it's because of the activation of the locus coeruleus, its connection between the amygdala and the locus coeruleus. So because of this, they would have increase in heart rate, blood pressure, which later on increases the risk of atherosclerosis, cardiac ischemia, changes in BP, heart rate variability, MI, or even death. So, in hippocampus and amygdala, so it has been said that anxiety can also be triggered not only by an external stimulus but also by the individual's memories. So, traumatic memories stored in the hippocampus can activate the amygdala, causing the amygdala in turn to activate other brain regions. So, hence the term re-experiencing. So, it's one of the particular features of post-traumatic stress disorder. So, here, I have discussed this a while ago also. So, the stimulation of the autonomic nervous system would cause tachycardia, headache, diarrhea, and tachypnea. It increases sympathetic tone, and usually they would respond excessively to moderate stimuli. So these are the neurotransmitters involved. So norepinephrine, so it has been said that there is an increased noradrenergic function. So the affected patients have poorly regulated noradrenergic system with occasional bursts of activity. So beta agonist and alpha 2 antagonist can provoke anxiety at panic attacks, while alpha 2 agonists such as clonidine can reduce anxiety symptoms. So for the HPA axis, there is an increase in the release of cortisol. So alterations in HPA axis demonstrated in PhD, there would be blunted ECTH responses to corticotropin releasing hormone, which is an important mediator of stress response. So stress increases hypothalamic levels of CRH, leading to activation of HPA axis and leading to increased cortisol and DHEA. So for serotonin, so in stress, there is increased serotonin turnover in the prefrontal cortex, nucleus accumbens, amygdala, and lateral hypothalamus. So clomipramine, which is serotonergic antidepressant, and buspirone have a therapeutic, that's why they would have a therapeutic effects in OCD. And then serotogenic hallucinogens such as LCD and MDMA causes development of acute and chronic anxiety. And then GABA, so the this is the major inhibitory neurotransmitter. So it is strongly supported by the efficacy of benzodiazepines in the treatment of some types of anxiety disorder. So because benzodiazepines will enhance the activity of GABA at the GABA type A receptors. And then neuropeptide Y, so it has a counter-regulatory effects on CRH and LCNE, leukoceruleus norepinephrine systems. So it occurs via NPY neuropeptide Y1 receptor, and then studies in soldiers have shown that they would have elevated or high levels of neuropeptide Y levels are associated with better performance. And in galanine, so in rat studies, so centrally administered galanine produces or modulates anxiety-related behaviors. And then this may be both galanine and neuropeptide Y may be novel targets for anxiolytics later on. So in brain imaging studies, so patients with anxiety disorders have various reported abnormalities in the following areas. So in frontal cortex, occipital and temporal lobes, parahippocampal gyrus, caudate nucleus, and amygdala. So in genetic studies, so it is recognized that heredity as a precipitating factor to the development of anxiety disorders, and almost half of all patients with panic disorder have at least one affected relative. So twin registries also support the hypothesis that anxiety disorders are at least partially genetically determined. So here is I have discussed this a while ago also. So for in the limbic system, there is norepinephrine and serotonin innervation, and high concentration of GABA A receptors, and then and hippocampal pathway would have increased activity, which may lead to anxiety. And then in cerebral cortex, so it is connected with the parahippocampal region, cingulate gyrus, and hypothalamus and temporal cortex. So in patients with temporal lobe epilepsy and OCD, so they may have clinical presentation po. That's all po, Doc. Thank you.
Thank you very much for that concise, but all the information that you need to know about the sorry, I'm going out of the house. So all the information that you mentioned a while ago are very relevant for you to understand the pathophysiology and psychological reason behind anxiety disorders. But let me just emphasize about a few things, like when we talk of anxiety disorders, we are actually looking at the cognitive, the emotional, the physical, and the behavioral response of the patient towards anxiety. Like, give me an example of a cognitive response to anxiety.
On decreased concentration po, Doc.
Sige, ako na lang
Sorry.
That's okay. So probably, but when we talk of cognition, it is how the patient interprets the environment or the event. So usually the interpretation is fearing something, or when the patient looks back at the event, there might be the remaining fear or recollection that the life or the life or status of the patient in the community is compromised. So that is how the patient reacts cognitively. And then, of course, next is the physical symptoms, wherein the patient would now feel the physical symptoms of anxiety. Please take note that among the psychiatric disorders, anxiety is manifested through physical symptoms. Of course, there's worry, which is the cognitive aspect of anxiety, but the physical aspect is more anxious provoking also with the patient. And then you have the emotional response of the patient. When we talk of emotional response, it just means the fear, anxiety, or worry. That's the emotional response. And then the last is the behavior, like uh, restlessness, agitation, crying. So if you assess anxiety disorder, make sure that you get all the facts. For cognitive problems and emotional reactions, we do psychotherapy. For physical symptoms, we give medications. And for behavioral, like agitation and everything, this is actually a result. This is just an external manifestation of what the patient is thinking and what the patient is feeling. So this will be addressed also through CBT. In anxiety, we usually use CBT. So this is just to parang i-clear lang sa inyong mind that when you assess an anxiety patient, look at the 4 aspects. These after the patient has been relaxed, kasi ano na yung kanilang mga noradrenaline, yung mga parasympathetic or sympathetic responses nila. After that, if the cognition is not changed, mauulit-ulit. Babalik ang patient sa inyo. Kasi there will be a recurrence of the anxiety symptoms because thinking has not changed. So when you see, actually in the clinics, anxiety disorder, one of the more common ones, only second to depression. But with the pandemic, mas marami na ngayon ang anxiety over depression. But long-term anxiety will also cause a depressive episode. Kaya when we talk about anxiety and treatment, we go through all that what Dr. Santos has mentioned a while ago. So I suggest to learn by heart lecture. Introduction pa man lang ito, but later on, why is this of the anxiety disorder? So I hope ganyan yung mind frame ninyo when we discuss the different individual anxiety disorders. So may question ba for now?
Ano naman po ba?
Okay, so uh,
Sino ang sunod?
Ako po, Doc, ang sunod.
Okay, so please, by 7 in the morning, can we have the link already
Yes po, Doc.
for next meeting? Okay, so do we have a conflict Wednesday sa inyo?
As per scheduling by Dr. Toledo, Doc, wala naman po kaming
Wala
ibang, yes po.
Okay, so kunyari lang, ay may endorsement man pala, no? Okay, so I hope you please study what si Peter has presented. I might give you a quiz before the lecture of Dr. Dave. So for
Noted.
now, stay safe, study well, so that pag nakagraduate na kayo, you will be confident in handling anxiety patients. We usually see anxiety patients at the OPD. Kaya lang, bihira, is rare to admit anxiety patients except for private. So please study well kasi bihira lang ang non-psychotic na pumupunta dyan. Okay? So bye-bye and wish me a safe trip. Okay. Bye-bye.
Have a safe trip, Doc. Ingat po.
Thank you.
Ingat po.
Safe trip po, Doc.
Thank you
Bye-bye
po,
po.
Doc.
Thank you po, Doc.